Kevin, let's jump into Medicare. Big topic. We got again, even for those of you that are listening that are not approaching age 65 when Medicare is available, this is still good to get some strategies, tips, for your loved ones that are older, etc. So let's jump into the basics. So Kevin, why don't we start with what Medicare is?
So Medicare was a law that was created to basically help seniors get access to healthcare in an affordable way. Tom, do you know who the first Medicare recipient was?
I do not.
All right. Harry Truman was the first recipient, and his wife Bess was number two. They had 19 million people initially enrolled. So, pretty exciting stuff that a president said, I'll be number one, I'll go first. Not a surprise, but uh, how much do you know about the different parts of Medicare?
So there's four parts. We have part A, B, C, and D. Why don't we break those down because I know a lot of people are confused by those.
All right, so Part A is your hospital coverage. You've been paying into Part A through your paychecks for 20 years, 30 years, 40 years. So what's great about Part A is you don't owe an additional premium when you enroll, and it covers hospital is the easiest way to do it. Now there's some other things with it, but think about it. You get hospitalized, that's what Part A is for.
Okay, so part A is just for hospitalization.
Hmm.
Is well let's start here. Who's eligible for it? So you have to be 65, correct?
That's right.
65 or disabled. Um,
So
part
you
A.
become eligible to enroll 3 months before your 65th birthday, and you have to enroll by 3 months after your 65th birthday. So they give you basically 7 months as kind of an open enrollment when you turn the year you turn 65 to get in and get started. And so if you enroll a couple months before 65 on your 65th birthday, you'll have your card in the mail and you'll start off. If you wait and enroll at actual birthday or afterwards, your enrollment into Medicare will be delayed either by a month or 2 months.
Okay, so basically like a 6 7 month window around your 65th birthday. So part A is for
And if
hospitalization.
you're still working, you still want to file for Part A. And there's a little nuance there that if you work for a large company, your private healthcare insurance from your company will be your primary coverage, and Medicare would be your backup. If you work for a smaller company, think somebody less than 20 employees, Part A would be your primary, and your private insurance would be your backup.
Okay, so let's jump into Medicare Part B.
So that's your doctor. This is your physician care. So anything outpatient. So this is lab work, this is home health care, this is physical therapy. But the easy way to think about it is this is physician coverage. And so this is going to cover 100% of preventative care and about 80% of outpatient care. And these are kind of the most two popular things you see. So everybody enrolls in Part A, and then optionally you can enroll in Part B as well. But this is where you want to go see your doctor. You need to call and ask them, do you accept Medicare? If they say yes, easy. If they say no, things are going to get a little tricky for you. You might have to find a new doctor.
Okay, so then what does
Part
Medicare
B has
Part?
a premium too, though. So you have to pay, and it's actually based on your income from 2 years ago. So I think this coming year, it's about $170 per month is what you owe. And if you are a high income earner, you're going to get hit with a surcharge. So the first surcharge is like $70 and $140. If you're in the highest, you might be paying $360 to $500 more. That's called an IRMA surcharge. And that is paid every single month. So for your highest earners, you might be paying thousands of dollars of extra Part B premium to be enrolled in Medicare that somebody who has low or no income. And let's keep in mind, Tom, there's a lot of things you can do to control your ordinary income rate when you work with an advisor, right? How much are we taking out for RMDs for your IRA? How are we collecting income? Is it capital gains? Is it dividends? Because those things don't count the same as just ordinary income being, put in your account by an employer or by an IRA distribution.
That's a great point. Okay, so Part A is included. Part B is an additional cost, and depending on how much you make in earned income, which to your point, we can help out with that. And then what is Part C?
So Part C is Medicare Advantage. So these are private insurance plans that would pay instead of Medicare. Um, it's an optional coverage. It's something that kind of all works together, and it's going to be kind of familiar to you in the sense that you'll have a Medicare Advantage card, and you'll treat it like your health insurance that you use in your private sector before you turn 65. And you go to the doctor, you show them your card, and they say, okay, here's your deductible, here's your copay, and it's going to feel a lot like your normal healthcare insurance. Now, not recommending it, just saying it's going to feel like what you have right now.
So is it more expensive?
it is more expensive, and there's an additional premium associated with it. And the plans range from, your simple plan to, the full Cadillac that includes a gym membership and some concierge coverage as well. So there's a lot of options within that, and there's a lot of plans to choose from. The good thing is that these plans are created by legislation. And so that means whether you buy a Cygnus plan, United Healthcare, whatever your preferred insurer is, they're all going to be the same. So if you buy A through G, it's all going to be the same. So when you're shopping, you can just say, I just like the customer service at that plant or at that firm, and it's going to be a similar coverage to what you have at the one next door.
Okay. And then lastly, Medicare Part D.
So this is the one that gets real expensive. This is the prescription drug coverage. So this is, simply going to the pharmacy, picking up your drugs, how much is it going to cost? And you can go to your local CVS, Walgreens, some local pharmacy. You can do something in the mail. It's important that you get something from in-network if you enroll in this. And this is a separate coverage. And so you got to shop for that each year during open enrollment. And it's voluntary as well. So if you're one of the lucky ones that doesn't take a bunch of pills, or the ones you take are very inexpensive, you don't have to participate at all.
Okay. And there's additional cost for Part D as well.
Mm-hmm. Yeah.
Okay.
And there's a thing called the donut hole where the first few $1,000s that you pay in prescription is going to be on you, or there might be some cost sharing. And then there's a gap where you're 100% responsible. And then over a certain amount, Medicare picks up the rest. So, but it can get $6,000, $7,000. And so if you are somebody who takes a lot of expensive pills, that's important to do. And if you go on the Medicare.gov website, you can actually search the prescriptions that you have, and it'll help you pick a plan based on your needs and your pills that you have to get each day.
Right. So this isn't a one size fits all. There's strategies behind it, as you mentioned. There's different parts to it. There's different costs associated with it. Some of it is standard, like when you can take it and enroll, but it's flexible. So I would definitely reach out. Do you know what the website is, Kevin, where they can go to get
So
that
it depends. So if you're already enrolled in Social Security, let's say you took it at 62 and you didn't talk to Tom and I about the benefits of waiting till full retirement age or age 70, you were automatically enrolled in Part A. And so you just go to your Social Security website, you can do that. You can also go meet in the Social Security office and schedule something in order to enroll. And it's pretty straightforward. Everybody, I mean, we got a lot of people turning 65, and so you have an opportunity to do this all the time. But what I would want to focus on is a couple strategies of how to handle enrolling in Medicare to limit your out-of-pocket expenses. So, we mentioned before, Part A, you paid those premiums, that's covered. You paid those each paycheck for 40 years, so now it's time to be done paying those. Part B is a separate thing. It's income, adjusted based on if you make it more than $200,000, just for simplicity, you're going to have a surcharge. If you're less than that, you're 165, 170. That'll go up each year with inflation. But what I want to talk about is the cost sharing aspect. So we mentioned Part C, which is Medicare Advantage. Those plans are okay. It's going to feel like your normal health insurance, which means that you're going to have a deductible, you're going to have an out-of-pocket maximum. But let's say you have surgery or you want to go out of network for a doctor, things are going to get really expensive because they're not going to be covered by that health insurance carrier anymore. And so if you do Medicare Part C and you enroll in a Medicare Advantage plan, you're either going to be an HMO or PPO, which means that you need a referral to see any specialist. So Tom, let's say your hip starts to bother you and you say, I think I might have to go see a specialist about getting hip surgery. That person has to be inside your network. And if you go out of the network because you want to see somebody else, that's not covered. And I think the better example is something like cancer, which if you are in certain states, you might have a really great cancer center like you guys have in Houston with MD Anderson, right? But let's say you live in Oklahoma and you live in Arkansas and you say, well, I really want to go to MD Anderson, but that's not in my state and it's out of network. I'd have to pay for that all out of pocket on this Medicare Advantage. So there's a different thing called a Medicare supplement, more commonly known as Medigap. And when you were initially enrolling at age 65, and this is a really important feature because you don't have to answer any health questions if you enroll the first time at age 65. You just go in, you're locked in, it's guaranteed renewable, you're going to be in it. So let's say you live in Arkansas or Louisiana and you want to go to MD Anderson and you're on Medigap, you're going to have your out-of-pocket maximum, and that's it. If you're on a Medicare Advantage plan and you go, that bill is yours. That might be $20,000, $30,000, $40,000 for all the cancer treatment. I've seen some of that immunotherapy, hundreds of thousands of dollars. And the cost sharing for that, you might be on the hook for 20% of it. You might be on the hook for more if you go out of network. So a Medigap policy is a way for you to limit how much you're going to pay out of pocket for major things going wrong.
Okay, so let's kind of break it down. There's basically three different levels. Level one is basic, is Medicare Part B. Level two, the step up from that, is Medicare Part C, which is more like your traditional health insurance. And then the third step is combining Medicare Part C with Medigap to give you basically full coverage for what you just mentioned.
So it's more of a either or. You can buy both, but I would say buy the Medigap policy, and there's higher premiums associated with it compared to the Medicare Advantage. But the benefit is that those higher premiums might be hundreds of dollars per year versus the cost sharing aspect. If you were to get sick and need some major surgery or cancer treatment, you're going to have to pay tens of thousands of dollars. And the other difference is out of network versus in network. Medigap is just basically Medicare is going to pay for it, and you have the supplemental to kick in. So you don't need a referral to see a specialist. If you, let's say you're a snowbird and you live in two different states, it might make a lot more sense for Medigap. If you live locally and you say, well, if I get sick, I'm just going to use a local doctor, so I'm not going to go anywhere, maybe Medicare Advantage is the right one. But Medigap's just a lot more flexible. And in my opinion, it's a lot simpler to understand because you know exactly how much your maximum out of cost is. So there used to be something called Plan F, and you paid all your premiums, and then that was it. You were done. Outside of a foreign travel emergency, 100% of everything you had was paid by that Medigap policy. Now, it was so good that people were showing up with very minor, aches and pains, and they say, all right, this is packing the hospitals or the doctor's office. We got to have some skin in the game. So now, the reason Plan G is great is your maximum out of pocket is $1,600. 100% of your coinsurance for Part A, 100% of coinsurance for Part B. You get blood transfusions. You got, the deductibles. That's all going to be covered by this Medigap, or many people call it supplemental plan, and that's Plan G. So all you have is $1,600 plus the premiums. You're in a situation where for the entire year between your Part A, Part B, and this Medigap policy and your deductible, maybe it costs you $4,500 to $6,000 a year, and that's it. Versus if you go to the Medicare Advantage, you might be on a monthly, a little bit cheaper, but if something goes wrong, it gets really expensive really fast. And that $1,600 is not going to be your number. Your number might be 16,000, or it could be much higher.
Now, a question we get a lot too: Are both spouses covered under this? If both spouses are retired, one's not 65 yet, can they go on the other spouse's coverage if they are 65?
They cannot. So it's an individual thing. So it's when you turn 65. Now, to be eligible, a spouse can still, in the same way Social Security does, if you stayed at home with kids and your other spouse worked, you're still eligible for Medicare in the same way you'd be eligible for Social Security. You could just kind of borrow the fact that they did that. And so you'd still be eligible. You got to wait till you're 65. So if you have somebody who's 65 this year, somebody else who's turning, 62, they're going to have to go find either private healthcare through the exchange or go on Cobra or find other kind of gap coverage for the next 3 years until they can enroll in Medicare.
Good to know. Any other tips, strategies, ideas around Medicare?
Yeah, just the last thing would be kind of two parts. One is if you need help with Medicare, we have a specialist that can help you go and shop for these plans and help you lay it out. And just ask us, and we can introduce you, and we can set you up for that. The second thing is if you've had an experience where, oh man, I already did Medicare Advantage, I can't get into Medigap. How does that work? Well, right now is open enrollment period, so you do have an opportunity. And the only thing that's going to prevent you from going to the Medigap where you can limit your cost sharing part is the medical underwriting. So you're going to have to apply. They're going to review your health history for the last 2 to 5 years, and you're going to have to go and say, I'm all good, or maybe there's not, and you can get hit with surcharges for a premium, but it's not too late to try to switch over. It just might require some additional steps.
So again, a lot of different ways to take it. It's not a one size fits all. It's like Social Security, same thing. Most people just realize Social Security, I can start at 62. Full retirement age might be 66, 67. But there's different strategies around how to use Medicare, how to use Social Security. So reach out. We have resources at our disposal that we can help you out with. All right, great. Well, thanks, Kevin.